menstrual issues. It's very painful, very, very painful. Sometimes I vomit a lot. I have stomach running too. Then I don't feel like talking to anybody. I just lie down and just think about myself. But I cry too. Sometimes I cry a lot. It's very painful. Okay, I drink a lot of water. Then I drink a lot of juice too. Something with sugar in it, but not a lot of sugar. But something that will make my mouth taste okay. Then I lie down a lot. I don't walk around. I don't do anything.
The pain is extreme. It's excruciating pain. Let me put it that way. So whenever I'm my menses, for the first 2 or 3 days, I can't do anything. The pain is that bad, so it slows me down, spoils a lot of plants. Yeah. When I take painkillers, that's what I do, basically, and a lot of water. Yeah.
I see it to be something normal. It's something I go through practically every month, so I've grown used to it, and I don't go through any extreme pain. So then, even during that time, I'm able to do whatever normal thing I'm supposed to do. Just that during that time I sleep a lot. Like, I feel sleepy most of the time, but that aside, it's just like any ordinary day.
Me personally, I have cramps during this period, and then because of the pain, you can sometimes miss class. We can't come to class because of the pain, because I can't be suffering it and being in class. It's really serious. It hurts. So I end up missing class if I'm really ended. I used to take drugs, but they said it'll get to a time, if it gets used to your system, you have to stop using it. So I tried using like other natural sources. They said you can use hot water on your abdomen and this stuff. So I've limited my intake of my painkillers now.
I say it to be something normal, because for me, I don't go through those challenges, as in pains and all those things. So for me, it's something normal to me.
You know, I went to school with a lady, Awo. I won't say her last name, but I remember she used to say that she loved having her period because it made her feel so womanly. And I thought she was nuts. She's the only person I've ever met in life who has actually said she loved having her period. I would love to ask her today if she still feels the same. But she loved her period, and I thought, are you crazy? Anyway, good morning, Doc.
Good morning.
Dr. Senyo.
Good nice to see you again on the Tuesday.
My pleasure.
Menstrual issues, the bane of every woman who menstruates. Okay, and
men as well.
And men too. Really?
Yeah, menstrual issues could affect men indirectly, sometimes directly. Yes. Some men just don't like those few days where women are not available to them. And then also, if it comes with a lot of pain, then they must be there for support and all of that.
It can be emotional sometimes.
I know.
You know it.
I know. I've dealt with women for God knows how long.
Okay.
What's something that we talk about?
Yeah, let's talk about men. Okay, so menstruation for someone out there who says they don't know what menstruation is. Let's basics.
Menstruation, the men part of menstruation, refers to month or monthly. So menstruation is like a monthly flow. You know that when every woman, starts to develop, from childhood, by the time they are able to accumulate about 15 to 22% of their total body weight, fat, around puberty, then together with development of breast and formation of the female shape and all of that, the first menses will come. Right. Now for some people this might delay. For some people it might not even happen at all for various reasons, which is out of the scope of this discussion. For others, it will start with a lot of pain. Understandably, if the lining of the womb, which is where the bleeding starts from, is shedding blood. Some of that blood collects in the womb, and then the womb basically has to contract to push that blood out. And sometimes that comes with a lot of pain. It is true that depending on the person's threshold for pain, they might experience it differently. But generally, menses can get painful because of the crampy nature. Now, there are some people who develop painful menses for no reason as in we don't find a cause for it. And so those people, usually what happens is that Once they're able to get pregnant and carry a pregnancy to delivery, then some of these will go.
Okay.
There are other people also who have a structural problem with the womb. For instance, they may have fibroids, or they may have something we call adenomyosis. Now, adenomyosis is simply when cells from the lining of the womb have migrated into the wall of the womb, either during development when they were growing up in their mother's womb, or through some procedure that sent those cells there. Now, typically, these cells that are dislodged in the wall of the womb will also respond to the hormones that bring about menstruation. So around the time of bleeding, you'll be bleeding into the wall of the womb. Then the wall becomes very engorged and gets really, really painful. But you see, that kind of blood that is stuck in the wall will not have any exit point. So it collects there, keeps collecting, and it causes a lot of pain. And that's adenomyosis. Now, some people also have endometriosis, which is the same as adenomyosis, but then the endometrial lining cells find themselves outside the womb, either on the surface of the womb, within the pelvis, on the ovaries, sometimes on the intestines, some people in their navel, some people in their noses and in their eyes.
Noses?
So yes.
And
so
eyes.
yes. So sometimes what happens is this, that around the time of menstruation, these cells that are in other sites other than the womb also begin to bleed. So wherever they are, if the bleeding is not contained within that space and it causes a lot of tightness, then there will be a lot of pain. So there are some people who will have a lot of pain in their nose and will start bleeding from the nose during their menses. Others will start bleeding from their navel, depending on where these endometriotic tissues are landed. All right. And of course, there are some people, yes, of course, there are some people also.
That's a simple instruction.
Don't eat the apple, right?
Don't take of the fruit in the middle of the garden. Don't take it.
And you take it. Right. And there are some people who have fibroids.
Yeah.
We all know that fibroids are these tumors that grow within the womb, either the lining or within the wall or on the outside.
Right.
And these fibroids, because they've taken up space of the muscle that is supposed to contract to let the menstruation flow, they cause a bit of disturbance in the coordinated nature of contraction. So then they cause pain. Some of the fibroids will also be undergoing changes like infection, degeneration, and all those will come with a lot of pain. But having mentioned those people who develop pain entirely out of reasons that we cannot explain, their pain usually will start either with the menstruation or a couple of days after the blood has started and then stops by either before the menstruation ends or by the time it ends. But those people who have the pain because of these other reasons, the pain might linger on even after the menstruation.
Wow.
Okay.
I'm sure when the phone lines are activated, a lot of women are going to call, and their main issue is that pain. So they need a cure for the pain.
Yes.
Now, two things. What can a woman do to prevent the pain if possible?
Right.
And when you're going through that painful period, what do you have to do? What are the things that you have to avoid? Taking sugar, taking milk, and all this. What are the things you have to do before your cycle?
Right. There are some people who've had this pain from menarche, the beginning of their first menses, and so might have developed a means of getting around it. Some people, like you said, some people will tell you that when I drink cold water, the pain comes. So they try to avoid cold water and take warm drinks, and then they're just fine. All right. Now, there are some people who also have, a concoction prepared, not traditional medicine, but a cocktail of medications that have been prescribed by a doctor, and immediately the menses start, they need to take those. So it works for those people as well. So these people can do these things to prevent the pain from coming. Now, if the pain has just come to meet you, and you are in it, you need to go to hospital. I know that sometimes friends and elders Women or people who've had experience will tell you how they've dealt with their pain. But like we mentioned, people have different thresholds, and you might be suffering from something so entirely different from the other woman. So they'll tell you warm water bottles, lie on the tummy. It's soothing. You know, whenever when you're dealing with pain, whenever you're able to introduce another thing that gives a different sensation, it tends to sort of mask the pain a bit, but it's still in the background. Once the hot water bottle goes, the pain comes back. Really? So avoid listening to people's own experiences, and then try and make a diary of yours, and then go to the hospital. We might just find out that you have fibroids, or you have adenomyosis, or endometriosis, or there's infection in the womb that's causing that kind of pain.
What about painkillers?
Well, now people abuse a lot of painkillers, and the most commonly abused are what we call the NSAIDs.
Okay, sorry. We need to go for a break now. Sure. After the break, when we come back, we'll deal with the painkillers and we'll find out why certain people can't do certain things before the time. Okay, we'll be right back after this break.
Talking about menstrual issues today. It's an important topic for women and men.
Especially men.
Yes.
Because for the woman, you know perhaps how to handle it, but for the man, he might get confused. You know, you might get confused because you don't understand the pain that the woman is going through. So for men,
some marriages suffer a lot because of menstrual problems, especially women. I mean, we've been talking pain, so we haven't talked about people who have periods like every 2 weeks, and people who bleed for 3 weeks and all of that. So some men actually do not understand how these things work, and so they make the women suffer. The women don't get their support. I mean, why do you keep bleeding all the time?
All the time.
You know, what's wrong with you? Let's go for another woman.
Doc, I thank this man, Reverend Bernard Adiakwa.
Right.
Oh, he's solid. He made me understand that half the life of a woman, she's going to have those mood swings because every 2 weeks she'll be going through that menstrual cycle. So if you're a man and you don't understand those things, every time that her mood swing change, you'll be like, what is your problem? What is going on with you? But I mean, Pakoku was asking about painkillers that people resort to.
People tend to abuse the painkillers that are so dangerous for them. People will tend to take brufen and aspirin and diclofenac. These painkillers belong to a group that can worsen or create erosions in the stomach.
Okay, good.
And then cause peptic ulcers.
More on that. So, Doc, tell us the painkillers that women must avoid.
The NSAIDs, or the aspirins, the brufens, the diclofenacs, and all of that. So these, apart from causing erosions in the stomach leading to peptic ulcer, they will also interfere with ovulation, especially those people who have the pain beyond their menses. Will keep on taking these medications, and any of these medications could stop the process of ovulation. You see, ovulation itself goes through an inflammatory process where the surface of the ovary is broken for, quote unquote, the egg to come out.
Okay.
All right. Now, if you take these painkillers around that time, then that inflammatory process is inhibited. So then you do not ovulate. And then that also tends to prolong the time that your next menses will come and also lead to menstrual problems. Now, quickly back to those who will bleed for a long time. Now, some people will bleed heavily, change more parts than they usually would, and bleed beyond 7 days. We know that menstrual flow should be anything from 2 days to 7 days. Less than 2 days, there should be a problem. More than 7 days, there's a problem. Or if you're someone who usually bleeds for 4 days, and all of a sudden is increasing, or the days are shortening, there could be a problem. So you definitely need to go and see a doctor. Now, when you bleed a lot, remember that it is not that some blood is kept somewhere purposely for menstruation that is coming out. So some people get happy, oh, all the dirty blood is coming out, so doctor, I'm free now. It's not true. Anytime you bleed, whether menses or not, it is blood that is supposed to be in your body and keeping you healthy that's flowing out.
Wow.
So if you bleed beyond a number of days, your blood levels begin to drop, your heart begins to race. So these people will tell you, anytime my menses come, I get headaches, I can't sleep, I get dizzy, and anytime I walk or work a little bit, my heart begins to beat out of rhythm and all of that.
So in
these
this
are signs of anemia.
in this regard, so do you need to top up? Do you need to get some
blood
tonics and all those things around this time? Do you necessarily
but you see, you need to see a doctor first.
Good. Okay.
Yeah, some people think that they tell you, I always say ferroglobin or this globin or that far, and it
always
works
need to see a doctor.
You need to see a doctor because we need to find out why things have gone out of order, and then bring some order to bear on it, either by doing certain procedures or giving you definitive medication that will sort the problem out.
Two things, Doc. Some people think that when they take alcohol at the time, it is fine.
Right. You see,
the second one is some people think that during that period, if they have sex, it lowers the pain.
Right. Now, the sex bit I'm not too sure of. Most people wouldn't even want to have sex around the time because of pain.
But is it unsafe to be intimate during that time?
It's not.
Okay.
Well, I tell people it's not. If you think about it being clean or unclean, then I understand. But it's actually not. You are not likely to get pregnant around that time, except people who have very short cycles. But during your menstruation or a woman's menstruation, she's more likely to infect you with whatever she has, be it hepatitis B or HIV or other sexually transmitted diseases. Because remember that cells are being shed off, and some of these cells may be laden with some of these disease-causing agents. But apart from these, it's entirely safe.
Okay.
Apart from these. Then to the alcohol bit. You know, the thing about alcohol is that alcohol has a history of being an anesthetic, all right? So, you know, anesthesia has both a component that makes you, go off from reality and all. So in the past, surgeries were done with alcohol. You know, bottles of alcohol, and then we do surgery. So someone who is in pain, who typically would take like a brandy or a whiskey or stuff like that, could ease the pain. But remember that alcohol also increases blood flow.
Yes, it does.
All right. Okay. So what you're actually doing is this: that you are able to upturn the pain, like to mask the pain a little bit, for the duration that the alcohol will be working. But after that, you are going to be bleeding heavily. So I do not advise alcohol use during
Please
menses.
call in if you have questions. You can ask about anything to do with menstruation. Okay. If you have questions about your flow, maybe the length, or whether you have a heavy flow or very light, or changes in your cycle, please do call in. Maybe you have a child, a daughter who has just started her menses, and you may have some questions. Fathers as well, call in. It's a lot.
I think the men should call more, because most men just do not understand the menstruation thing. Some people want to make babies, and they are outside this country, or they are working outside Accra, and then they don't time the menstruation well, and they come and they're angry with the women. Why are you getting your menses now? And all of that. So they need to be educated more. So men should watch this program, call in and ask questions. Now, there are some women who might miss a few months of menses and probably think that they're pregnant, and start feeling all the pregnancy symptoms because psychologically they think they are, and come to hospital and they're not pregnant and they're so disappointed. Now, some of these women have what we call polycystic ovarian syndrome. We've discussed this on the show before. Now, with these people, there's a bit of hormonal imbalance, which leads to very, very tiny eggs in their ovaries, numerous but tiny. Now, if we are assuming that every egg or follicle is supposed to grow up to a certain size before ovulation can happen, and when ovulation happens and there's a sperm to fertilize, there'll be a pregnancy, but if there's no sperm, then there'll be menses. All right. Now, if it takes such a long time for a tiny egg to reach the size that ovulation can happen, then it means that's how long your period is going to take to come, all right, or pregnancy is going to take. Now, some of these people, because of the hormonal imbalance, the eggs might take 2 or 3 months to develop, so they don't get to see their menses. And because of the surge of other hormones, they start getting facial hair, big boys, and all of that. And there are other people as well who have a condition. Where is she based? Who have a condition called hyperprolactinemia. Now, there are levels of prolactin. Pro means to promote, lactose as in milk. All right. Now, these people have some hormone in the brain that goes high and is able to suppress the hormones that control the menstrual cycle.
Right.
So what happens is that you see them producing a bit of milk, or when they squeeze behind their nipple, they have this milky discharge that comes. All right. Now these people, because of the high levels of prolactin and the suppression of the fertility hormones, they would also not see their menses. All right. So there are a number of things that will make people not see their menses for a while.
Okay.
And so you need to come and see a doctor.
What foods are you supposed to take and avoid?
Right? Now, most people who keep a diary, and I always stress this diary thing, because, you know, sometimes science is not able to explain everything. And your doctor, I mean, me, I don't know everything. So people come to you and tell you specific foods that when they ingest, their periods increase, or they get more painful, or it reduces. All right. Now, definitely, foods that are rich in iron are bound to give you more blood, and so you probably get more blood flow. Now, people who are generally anemic do not have enough blood, so will not bleed as much, or sometimes miss some of their menses. All right. So eating healthy is key. Eating foods that promote blood production is good, like what we call kantose or amajuli. They are all good.
Okay.
And then sobolo.
Sobolo. Oh, really? Sobolo is
Debbie.
good. Yeah, Debbie.
Hey,
Hello.
Yeah.
please, I want to ask how to reduce the menstrual pain.
How to reduce menstrual pain?
Okay.
Yes, please.
So I'm thinking that she takes painkillers. But
I'm sure.
what you're saying,
Yeah. So you need to start with a visit to a gynecologist, and then have your pain well discussed, and then probably we'll find very simple ways of stopping it. But in the meantime, whenever your period is approaching, try and keep track of things that you do, foods that you eat, and watch and see whether it worsens the flow of pain or decreases it.
Right.
And then come to see the doctor and let's discuss it.
But what is the prescribed drug that you can say, okay, this is fine for you to take?
Oh, well,
rather than the
you know,
Brufens
generally
and the
you can take paracetamol to start with, and then the painkillers that do not have these components in them. Those are safe. There are specific medications that would deal with the contraction of the womb and then the flow of blood and all of that. So these are given under the supervision of a doctor. Now, quickly, women who are very, very, very active, sports women, all right, tend to have a bit of change in their hormones. And so most of them would be missing their menses as well. So if you're a woman who is a physical training person, or you play for Black Queens or Princesses, or you're very active and you don't see your menses for a while, don't be so alarmed. You need to see a doctor to sort this out. And then, of course, women who have abortions or terminations of pregnancies, where their womb is overscripted. All right? What happens is that the whole lining that's responsible for the bleeding is taken away, and so the two surfaces of the womb, when they come together, they seal off. And so these women also might not see their menses, but they keep getting the pain that comes with it, but no blood flow. They as well will need to see a doctor. So there are a myriad of issues surrounding menses, and so we'll probably take our time another time and take the specifics.
I know,
I'm enjoying it. I'm enjoying the conversation.
Very intrigued about
I'm enjoying the conversation. Yeah.
By what age, if a young woman is not seeing her period start by a certain age, could it be a problem?
If the average for most areas in the world is 12 to 14 years. Now, if you haven't seen menses by 16, there should be there's a problem, especially if you haven't developed breasts as well by 14 and you haven't seen the menses by 16 as well, then there could be problems. Or if you have developed breasts and you haven't seen menses beyond 16, then there should be a problem.
Good morning, Gifty. Hi, Gifty, how are you?
I'm fine, thank you.
Okay, good. Doc is here.
Good morning, doctor.
Good morning, Gifty.
I have a problem. I'm 47 years old, and I'm having excess bleeding. I bleed very heavy.
All right. Have you been to see a gynecologist?
No. I thought maybe it's normal because normally I have it 4-5 days, but now it's 7 days, but very heavy.
Yeah, you definitely.
And I noticed that something hard under my lower abdomen.
Right. Now, touch wood. I mean, if you start feeling something hard, you see, your womb itself is just about the size of your fist and it's hidden below your pelvic bone. So if you begin to feel anything above the pelvic bone, then it means that there's something in the womb. If it's not a pregnancy, then it's all the things we've mentioned, from fibroids to adenomyosis. You definitely need to see a doctor. I can hear a baby crying behind you, so you've made some babies, all right? So you need to see the doctor, and let's see what the problem is. And the solution would come also. Well, I think the baby is disturbed.
No, just see a gynecologist. I mean, doctor's number is on the screen, so just pick it up and call in.
Oh, doc, I know we have to go, but is it, very quickly, is it possible to be pregnant and have your period?
Right, it's possible to be pregnant and bleed, and it's dangerous. Now, if you are pregnant and you're bleeding, it's definitely not your menses. You see, your menses, the last menses that created the pregnancy was the menses. After that, anything else is called bleeding in pregnancy, and that is dangerous. Sometimes it could just spell the implantation of a pregnancy in the womb, all right? And that is fairly okay. Now, beyond a certain point, it's dangerous. You need to see a doctor.
So what about all these women who say, oh, I didn't know I was pregnant because I was getting my period?
No, it's not true. They are misinformed. The thing is that those who carry those pregnancies to the end are actually lucky. Because there are some people who would go ahead to have a miscarriage.
Oh, okay.
Right. With the bleeding.
So
yes. Okay, so if you're bleeding and you're pregnant, you need to get it checked out.
I really enjoyed this conversation.
I know you have.
I really have enjoyed it. The next time we'll deal with something else that's got to do with the same thing. I mean, knowing your cycle, knowing what to do when. And like you said, for the men who travel and they come back and they say, why are you in your menses? You have to time it properly.
Definitely,
so you know what to do.
I will bring a gadget onto the set, which people must patronize. Which will tell them if they are ovulating or not. Yes, we spoke about
it. It's like a pen. We carry it like a pen.
I know you have to go, but just a quick one. This is out of here. This goes to my friends at the Department of Radiology in Kolebu. People seem to think that because I come on TV, they need to tell me things are happening in the health sector. Now, if you're listening this morning, people at the MRI center are being very, very, very rude to patients, especially elderly citizens. So if you're listening this morning, let's check it. Your front desk, has a number of people there who are always on their phone talking to patients anyhow, and I think it's bad for the image of the health sector.
Yes, your profession. You get so much flack.
Department.
Oh, dear. Please.
Okay, Zenaida.
Yeah.
Very soon I'm going to have a pen in my hand. When I see, I just chat. Are you ovulating? Bing. Ovulating.
And if I'm ovulating, what are you going to do?
Nothing.
What does it do to you?
I just write the news.
I mean, does it change your life? Okay. Zenaida, go ahead.
Okay, let's now go for the last leg of news.